Sadly, we've seen a wide range of injuries to mothers. So we've seen mothers that have suffered perineal tears, also known as OASes, or third or fourth degree tears. We've seen mothers who have suffered postpartum hemorrhage or not had appropriate treatment during the pregnancy, leading to stillbirth. We've seen mothers who have had inappropriate treatment while they're undergoing IVF. And we've seen mothers who have attended for their 20-week scan and an abnormality hasn't been picked up. So really, we've seen a wide range of injuries. So the most common type of injury we see is a perineal tear. So it's mothers who have sadly suffered a third or fourth degree tear following the birth. The situation that normally gives rise to a case is where perhaps they shouldn't have had an instrumental delivery, or it's not been managed appropriately, causing them to suffer a tear, or the tear occurred non-negligently but hasn't been repaired properly. Sadly, we do see mothers that don't even know that they've suffered a tear until they're going home and they're experiencing symptoms of fecal or urinary incontinence, and they then go back to the hospital and it's diagnosed sometime later.
Birth trauma and birth injury aren't exactly the same, although their terms are used interchangeably. Birth trauma refers to the emotional and psychological impact of a difficult or traumatic birth. A birth injury refers to the physical injury a mother has suffered during childbirth. Of course, a birth injury can contribute to a birth trauma, and we represent mothers suffering both injuries. It will be important to investigate, first of all, whether you have suffered a recognised psychiatric injury. If you have, then you will likely be entitled to some compensation. The level of that compensation depends on the severity of your injury and the impact of that injury on your day-to-day life. With you and an expert, we will explore your injury and your ability to look after yourself and your family, for example, as well as your ability to return to work. We will consider whether there are any additional treatment needs and the cost of that treatment, together with your long-term prognosis for your recovery and the future. We will then be able to advise you upon the level of compensation in your case.
So the law states that you have 3 years from the date of negligence in which to bring a clinical negligence investigation. So that would usually be 3 years from the date in which you've given birth. There can be an exception for a mother who has a later date of knowledge of that injury. So for example, they might have learned that later down the line of an injury they suffered at the birth. And in that case, we can take 3 years from the date of knowledge of that injury. Those arguments are slightly more complicated to run, so ideally we would use a date 3 years from the date in which you've given birth. That being said, one of the recommendations set out in the government-backed Birth Trauma Inquiry Report is for the time limit to bring a clinical negligence case for mothers to be extended from 3 years to 5 years. And that really recognises that there are many barriers present for women who are entering early motherhood, perhaps dealing with birth trauma and a birth injury, which prevent them accessing justice and accessing the opportunity to investigate the claim legally. So we wholeheartedly support that recommendation. Even if you are out of time and the 3-year time limit has lapsed, there are circumstances where we could ask a court for your case to be heard, and we've represented many mothers and ensured they've got the access to justice and that their case can be investigated.